Vietnam. And please, he would like to introduce the topic management orbital axis complication of sinusitis report of cases, please.
Good afternoon, everyone. I'm very happy to stay here to present my topic with the management orbital abscess complication of rhinosinusitis case report. The first, as you know, rhinosinusitis is very common disease in North Vietnam and around the world. And complications may be defined in clinical, orbital, and body. And orbital abscess complications are severe consequence of rhinosinusitis. The condition affects the tissue within and around the orbit, causing significant visual impairment and potential line thickening. Early detection and time surgery play important role in treatment. We report case study of the abscess patient due to the rhinosinusitis. The first case, the female that only 18 months old. He admits our hospital with the symptom with swelling in the right eye and the symptom of acute bacterial rhinosinusitis with the purine discharge, fever, and increase in the right side. You can see the endoscopic side with the inflammation in the method and the purine. And on scan, you can see the opacity of the left, of the right, maxillary and the edmasinus and especially we see that the offset orbit in the medial and in favor of the right orbit. A patient has a right endoscopic surgery to sinus rigidness and abscess rigidness, and results post cancers we found that Staphylococcus aureus multi-drug and sensitive to quinolone, vancomycin, and lateris. And patient visited with vancomycin IV, and after 4 days, orbital reduced swelling and return some of the normal after standard. The 7-year-old boy who admits the hospital with swelling and pain on his left eye. The disease progressed for weeks, and child developed nasal discharge, increased pain and swelling left eye, and blurry vision. On CT scan, we see that all the maxillary and sinus opacity, and we see the offset on the orbit in inferior and medial orbit. And the eye vision with impairment in the left eye is 20/100, and the right eye is 20/40. The patient has a left endoscopic surgery, the first to sinus rigidness, and second to approach endoscopic to rigidness abscess. After we push the orbit on the outside, we see that many purine on the into the nasal cavity. And the result of the post-cancer shows the multi-drug Staphylococcus aureus bacteria, and so patient was allergic to vancomycin, so we used levothyroxine and methylprednisolone IV. After surgery 2 days, the vision improved, and after 6 days, the vision returned to normal. Right eye is 20/30, and left eye 20/25. The third case, the female 58 years old was admitted hospital due to the nasal discharge and congestion, swelling, and pain in the right eye. The patient has been symptoms for the 10th day include purine nasal discharge in the both sides, nasal congestion, pain and pressure around the both eye, and middle numbness in the facial area. And history patient rheumatic arthritis with using long-term oral steroid. On examination, we see that on the right side patient with the chemosis, photosis, and the extraocular muscular impairment. On CT scan, we found that all the sinus, muscular, and the ethmoid and sphenoid opacity, and especially on the muscular sinus on the right side, we see that hypertensity on the right side, and the upset imaging in the lateral, inferior, in the right orbit, especially in the visual acuity of the calf sphincter on the right eye. Patient has endoscopic theater with an external incision radius of abscess on the right eye because the location of abscess, as you know, because the location is lateral and inferior. And cancer and biopsies sinus mucosa result for that. So good, anginosus, and the lesion of muscle sinus was invasive asparagus fungi. A patient was treated with antibiotics with systemic antifungal treatment after sensitive IV, and after 2 week adjustment, patient vision with normal. The first case, patient, the male, 63 years old, has severe isothermal chemosis, ophthalmologic, and especially visual acuity of his eye, right eye is lost. And endoscopic side, we said that's the middle metas and spot and edema mucosa. On CT scan MRI, we said that's Ramakei, or the right side with the trail scores. And hypodenser is the medial and inferior of his right side. On MRI imaging, we said that's the offset location is inferior and medial of this. And the blood test shows a high infection with white blood cell 26. Patient has done with endoscopic sinus on the right side and radius of it upset on the right eye. And after checking the acid process, we found that the cause of the sinusitis is foreign body, bamboo to stick with a length 2.5 centimeters, and the push cancerous negative. As antibiotics with vancomycin with the middle name. And after 11 days of treatment, the eye looks normal, movement normal, but the patient vision is not recovered. Discussion. The first, I want to introduce discussion as a patient. Over 44 scale, 2 were children, especially just only the 18 months old. The other report that young the diagnosis with after rhinoceros was not only 8 months and only was 75 years old. And common signs of abscess due to rhinitis maybe contains the first, the common side, the severe ptosis, chemosis, omatopraxis, and visual impairment, excessive sometimes maybe the visual loss. And the symptom of rhinitis maybe with the nasal discharge of junction and andoxide, purine in middle method, and edema mucosa, and infection sign with a fever, raised CRP or white blood cell. And with the imaging, the CT and scan, and with the MRI is very important to diagnosis and surgical origin, orbital complication, rhinosinusitis, and should combine CT and the MRI. Treatment with orbital abscess due to rhinosinusitis, we should combine medical therapy and surgery, and it should consider is a medicine case. The medical treatment, the anti-drug is very important, even in West fungus disease, such as in third case in our case report. Antibiotic therapy is still necessary along with anti-treatment. In our case, vancomycin is often used treatment, can combine quinolone or middle, but vancomycin is still the main drug. The choice of antibiotic depends on the type of bacteria and the local prevalence of resistant bacteria. surgery. Surgery, we should do two things. The first, sinus drainage. The second, upset drainage. Upset maybe the endoscopic and external depend on the location upset. If location upset is major, we can drainage by the endoscopic. But location is the lateral, maybe the external approach. Result, in our four case, there are three cases of vision that complete recover after treatment. And one case, the first case, due to foreign body bamboo acoustic, not recover vision. Conclusion. Optical abscess complication of rhinoceros is a serious disease that threatens the vision and the line patient, which can appear any age with many different curves. Early detection, timely surgery, and aggressive medical treatment will bring good results. However, if the loss of vision is very difficult to restore vision. Thank you so much for attention.
Thank you so much for the interesting presentation. We reserve the questions during the question and answer session. Right? So the next speaker, I would like to introduce Professor